over that statistic again?
So the number of families on an open case just 3 or 4 years ago was 80, in the 80s. Today it's over 450, representing roughly 1,250 children, 200 of whom are under the age of 2.
And what do you define as an open case?
Go ahead.
There's also been a lot more emphasis on kinship.
Yes, and as Doug pointed out, there's much more emphasis now on kinship care than there was previously. But open case is a situation where we're involved, a family has been called to our attention, we may have done an assessment, and we would have done an assessment and determined while there's some risk involved, it's not to the level of going to court and asking for a child to be removed, but some level of intervention is necessary to support that family. Does that help?
It's not. So that number went, in this 5 years we've been talking to?
It moved dramatically, yes. And that was
400?
intentional. It was an intentional policy.
So that's 500%.
No, it's big. It's been a big, large increase, absolutely. Yep.
Okay.
Commissioner, I'd like to pose the same question to you that I asked the governor. Do you think that DCF is too focused on reuniting children with parents? And it sounds like with this explosion of whatever it's called, open cases, the DCF is involved with more people, but not necessarily to the same extent as they are with that 1,000 group.
Well, believe me, those that are in custody we're very involved with. When I look at the data, and I've asked myself obviously that question over the recent weeks and months, the data would indicate a balanced approach. Last year, for instance, we had approximately 200, slightly more than that, 200 children under the age of 2 in our care who left our custody. 49% were reunited with their mother or father. 90%, 10%. Like there's some balance. When I look at the data over a period of years, a 5-year period, roughly 56% of our closures were reunited. That doesn't conclusively, answer your question, are we too focused, are we not focused? But to me, it gives me a good framework of the nature of our work. And if that number were really high, I think I would be concerned. I'm always concerned, but I think there's the proper balance in terms of striking that. I also think it's important to point out, many of you may know, but for the audiences that you report to, DCF doesn't make these decisions in isolation. A child never comes into the custody solely on our say. They come through the court process. Nor do they go home solely on our say. A guardian ad litem is involved. A lawyer for the child is involved. The parents, biological or otherwise, have attorneys. The state's attorney's involved. The social worker's involved. And ultimately the judge makes that decision. So it's tempered. These decisions, I think, are thoughtful, they're considerate, as well there should be a checks and balance.
This move to at a supervisor level before reuniting a child who's had serious injury, I think there might be some Vermonters who would be surprised to learn that something like that wasn't already in place. Why hadn't it been? Had that come up before, previously?
Historically, I don't believe it had, and I'm going to, if Cindy wants to jump in, she can. I've asked myself that question too. I think we have a system, not making excuses. We have a distributed model of our district offices, and there's autonomy and authority there, but it's not without supervision and control as well. There should be, and this is a issue in hindsight. Do I wish we had changed that policy? Sure, absolutely. But I think, and this is the part when I said I'm not making excuses. Our central office, we had 96 staff in our central office. Today we have 66. We're the victim of post-recession, like many other businesses and state government. That's why I'm more than pleased. The investments we're making with this initiative, while in no way does it bring us back to where we were, begins to strengthen that central office capacity to do the oversight work that's very critical. We made every effort we could, always, whenever we were downsizing, not to diminish the capacity of our district offices in the field, but instead reduced our administrative infrastructure. And that has limits.
Well, how far do you think that limit went? Or did you exceed that limit when you were downsizing and trying to get,
Well, let's remember, we're using the royal we here. We've been building it back up since I've been governor. We were not the ones that cut it all the way down. Chip?
Yeah, I just wanted to supplement a couple things the governor said. One, the timing is good on this new position pilot that the legislature passed as part of the appropriations bill. The caseload savings really only became evident at the very end of the legislative session. So it wasn't new information we had. We believe that these caseload savings will be ongoing. And the legislation allows for departments, a handful of departments that were part of the pilot, including the Department of Children and Families, to manage to the bottom line as long as the money is available within that department's budget, which this is. So this was over-reliance on temporary employees. Part of the plan that the department has put together actually replaces some temporary employees and reduces the need or eliminates the need for us to go out and hire more temporary employees as opposed to training people and having them on staff. So I wanted to clarify that on the position pilot. And the governor has the authority to reorganize state government. Depending on the level of reorganization, it probably requires an executive order, which when the report is in, we would anticipate most likely using executive order to do this. And if the legislature wanted to choose to overturn it in the next session, they could do so. But, we believe that if we choose to move forward, we will have a strong case that will have legislative support. So I just wanted to supplement those couple.
Thank you.
Commissioner, what led to those job cuts you mentioned from the staffing positions? Because as I'm looking at the budget over the years, it's only changed by about $7,000, $8,000, give or take. That doesn't seem like 20 positions difference in the budget.
Over the years, you mean, when I talk about the reduction
Yeah,
to the
so
central?
83
Well, that was a response to the downsizing of government. What led to it was the Great Recession.
But Kyle's saying
Am I missing the
Kyle's
point?
saying it didn't happen.
No, I'm asking him.
I understand it.
I'm asking
Your question,
the
Kyle.
budgets, the total budgets for the department aren't varying by more than $7-8 million in a year. Are you really saying that that's 20 positions and that's $7 or $8 million?
Oh, sure. We have, with union contracts and step increases and normal budgetary increases that we have and caseload pressures and such, budget is still growing. It certainly would have grown even more had we not done the downsizing.
The point is, the ratios that I cited are accurate, I hope, which is that we've seen a decrease over the years from the height of the recession. We were down to a 20-to-1 ratio in 2011. That's just the people on the ground that are there to do the work. We now got it down to 17-to-1. We want to continue to improve those numbers.
I guess my point is the fiscal year '08 budget was $86 million. As of fiscal year 12, it was $86 million, and now it's $91 million.
So what the commissioner just pointed out is that with step and salary increases and other increases for employees, we're in the employee business, that are built into contracts. When you see a level funded number like that, or one that goes up slightly, you have to reduce positions to get the same result.
Or
That's what's
lay off
happened.
more tenured employees and hire younger ones.
Well, it's not quite that simple in state government.
Commissioner, what is the protocol now if a caseworker visits a home and sees evidence of abuse, bruising, et cetera? What happens? Can you walk us through that?
Sure. So when a staff person goes into the home, sometime they may be accompanied by the police, and oftentimes not, depending on the information that we have when we make the visits. So if a staff person is alone and it's very clear to them that a child is in harm's way and not safe, the courts are available on a 24/7 basis, and we contact the court and act and move and get a temporary removal of the child. If the staff person is accompanied by a police officer, the police officer has that authority. Staff on our own do not have the authority to remove children.
What's the protocol for how long it takes if there's a report from a hospital or whatnot that a child is injured? My understanding in this case, it took 2 days for the DCF to show up.
So I'm going to remind us that we're not here to talk about the individual cases, and I'm not going to let us talk about the individual cases.
Is
So-
that an issue of staffing, or is there a protocol to how quickly a response happens, or because of
There
staffing?
is a protocol to how quickly
How
a
quickly
response happens.
does a response happen?
I'll let the Commissioner give you the numbers.
We're required within 72 hours. That's in statute.
Is that what happens in practice?
Pardon?
Is that what happens in practice?
Yes.
So not thinking of those two cases specifically, but the aftermath of those two cases, has that made life difficult, or not difficult? How has that changed the life of the social workers who actually are working on the streets? I mean, are they more, would they be more likely now to try and take a child into custody? Has it changed the way they do business at all, do you think?
I would hope that we reserve judgment on how this case should change behavior until we have the facts on the cases. And listen, I know that when we lose a child or we lose children, we all want to get mad, and it breaks our hearts, and we want someone to blame, and we want to find ways to fix it. I would just caution all of us to do the blaming and have the solutions on how to fix it until we know the facts, and we don't have them yet.
But Governor, aren't these changes, while perhaps not in response to an investigation that's going, aren't these in response to those deaths?
These are in response to a big picture look at how we can better protect Vermont's children in light of rising demand, rising drug addiction that's driving terrible things that are happening to our kids, and the big question of how do we respond to increasing caseloads, increasing circumstances where parents or caregivers do terrible things to their kids, sometimes because they're addicted to opiates and other drugs. And are there steps that we can take as a state to do even better?
But didn't
They are
these
not a
deaths-
response to the particular details of these two cases.
But didn't
Because
they
I don't know
spur the big picture look?
Obviously, they spurred the big picture look, but there's a difference between saying, hey, this is heartbreaking. What can we do in terms of systems, not related to these two cases, but systems, to ensure that we have a better fight, better chance of winning the fight, than it is saying, this happened, these circumstances happened in these particular cases, and this should be our response. I would caution us to assessing blame or thinking we have the answers until we know exactly what happened.
Could I just step back for a second? You'd mentioned that that the reports of child abuse had doubled. Have the substantiated cases seen a similar increase?
I think let Dave or Cindy take that. Who wants to take that?
The percentage that have been substantiated has remained relatively stable over time. And all of that data is available in our annual child protection report that is available on our website.
What is that indicative of? That the substantiation rate has stayed flat, but the number of reports has doubled?
I think that it reflects the concerns that community and family members have about Vermont's children. And some of it's a result, after Brooke Bennett died several years ago, there was a huge emphasis on the training of reporters. And we have a very robust system of training of reporters, so they are very likely to call us, which is what we want.
I thought you meant us.
Oh, no, mandated reporters.
The outside advisor group that's supposed to be doing the independent thorough
Right.
DCF, they were paneled a few months ago. They have not met yet.
I don't believe
No, they
that's
haven't.
accurate. They have met.
I think it possibly defends your definition of meeting. Regardless, how much faith do you have that they're really going to get to the bottom of this and give the public
Listen,
an honest
I
look?
have full confidence in the folks that are undertaking the independent investigations of both these cases under Dr. Hagan. You've got to understand that when there is a criminal inquiry going on, when babies' lives have been taken, the first priority is to not get in the way of the criminal investigation so that we can bring those killers or killer to justice. That's our first priority. Priority 2 is the independent investigation that we will use to help make judgments about things that we could be doing differently. So You got to understand those pressures, they're real, and I don't want to be here in any way impeding my desire to bring these killers to justice because we were so anxious to get an independent report completed.
I'm sorry to go back to my previous question just quickly. Were you saying that people are more likely to report abuse, therefore abuse has increased, or they're just more likely to report?
I mean,
Both.
Both. But what happens in the cases Cindy just pointed out of Brooke Bennett, or frankly in cases like Desiree or Peyton, is that you do see an increase in the number of concerned calls that you get.
But so we're just saying fundamentally children are less safe now than they were 5 years ago.
We believe that because of opiate addiction and other challenges that families are facing, that the incidence of abuse to children is a bigger challenge than it was 5 years ago.
It's increased.
But the substantiated cases haven't increased, so.
The rate.
But there's
has
more
not
of them.
increased.
The number has nearly doubled, the rate
But
But
is
the
essentially the same.
percentage has stayed.
It's kind of like,
the
the ratio of substantiated versus unsubstantiated has not changed, but we have a bigger pie now. There are more
Right.
people, there are more cherries in the pie.
Has it, in either of these cases, has anyone been reprimanded who works for the state?
Which cases are you on now? Desiree and Payne? Good try. Thank you very much.
We've only got about time for
Have
two.
you
Short
talked to
topics.
IBM or Global Foundries about a possible sale?
I'm not going to comment on the details of what I'm reading about in the press or my desire to keep the jobs at IBM strong in Vermont, except to say this. My job as governor is to try and stay informed as to what's going on by reading the press, listening to folks, and have the tools in place to be able to maximize the potential should there be a sale. And again, that's based upon press reports, but should there be a sale, to maximize the potential of keeping those jobs in Vermont that are so important to us and thriving in the future. So that's really my goal. And so all I can say about any rumors, comments about IBM or any other companies is this. As governor, I will do everything that I can to keep the jobs in Essex Junction and to have a future where we see growth and prosperity.
Care to quantify the anything we can?
Not really.
Governor, Nevada just scrapped its state-based exchange. Oregon has, Maryland has, Massachusetts is considering it. Roughly a third of the people paying commercial premiums through Vermont Health Connect are having problems with their coverage that are being difficult to resolve. CGI just missed another deadline, or you guys pushed back another of CGI's deadlines. Should Vermont be considering scrapping its exchange and going with an exchange in the box from Connecticut or another state, or going with healthcare.gov?
No,
Why?
because for individuals, our exchange is getting the results that we want. And we know that we've got more work to do, we're doing it. But the bottom line is, Vermont has more people per capita by a fairly significant number enrolled in more affordable health care through the Affordable Care Act, going to the exchange than any other state in America.
But a
So-
third of the individuals paying commercial premiums, the people that are really relying on the website to make payments, are either in the wrong coverage or can't change their address or can't.
And as you know, Morgan, that's something that we're working to fix, and we'll continue to work to fix it until we get it right. But all I can tell you is to suggest that when we're the state that signed up more individuals on our website than any other state, that we ought to scrap it, sort of seems a little bit foolish.
It's proportionally, and you also mandated small businesses in.
Well, Morgan, you're hard to please. All I'm telling you is that's what we're doing. Thank you very much.